Hi, my name is Katie and this is my persuasive speech. It can attack us at any time, wiping out thousands of people on the planet. Not only are you at risk, but your grandparents and younger children will be hit even harder. The early symptoms will hit like a common cold, but once you realize you've been affected, it might be too late. According to the Centers for Disease Control and Prevention, a total number of 185 pediatric deaths were reported for the 2017 and 2018 flu season. And of those children, about 80% of them were not vaccinated. That percentage would be a lot lower if we vaccinate ourselves as well as our children. The influenza, more commonly known as the flu, is a viral infection that attacks your respiratory system, which includes your nose, throat, and lungs. The flu travels through air droplets when someone who is infected sneezes, coughs, or talks. You can inhale the droplets directly or pick up the germs from the items the infected person came in contact with. There are 4 types of flu viruses: A, B, C, and D. Influenza A and B are the ones that circulate and cause seasonal epidemic of disease, which is why it's very important for everyone to get their flu vaccine each year. Common symptoms of the flu include a fever over 100.4 degrees Fahrenheit, aching muscles, chills and sweats, as well as fatigue and weakness. Some people will even develop severe complications due to the flu, like pneumonia, which is life-threatening and can result in death. According to the World Health Organization, the best way to prevent the flu is the flu vaccine. First, I will explain who is at risk the most and how they can be helped. Second, I will clear up many of the myths regarding the flu vaccine. And finally, I will recap the 2017 and 2018 flu season. Let's talk about people who are at risk the most. First, children who are ages 5 and under are more likely to have health complications compared to adults. That's because their immune system is not fully developed. To protect them, you can take them to the doctor to get the flu vaccination. Some children require 2 doses, and it is recommended to get both to receive full protection from the flu. Children 6 months old or younger are too young for the flu vaccination. So that's why it's very important to protect them. To protect them, you can make sure the people your children comes in contact with are vaccinated. Second, we have adults above the age of 65 who are at greater risk for serious complications from the flu because their immune system weakens with age. The flu can also worsen their long-term health problems if they have any. To help them, the U.S. Food and Administration approved a high-dose vaccine for people aged 65 years and older called Fluzone High Dose. According to Healthline, it carries 4 times the regular dosage and helps provide a stronger immune response and antibody protection. So even if you are older, there are options for you. Third, pregnant women are more susceptible to illness compared to women who are not pregnant because their bodies go through changes that affect their immune system, heart, as well as their lungs. If they get infected with the flu, it can cause premature labor and birth defects in the unborn child. The best protection is early treatment. According to the CDC, the flu shot protects both mother and child up to 6 months after birth. And lastly, people with weakened immune systems have an increased risk for complications because they are less likely to fight off their flu infection. And according to Piedmont Healthcare, getting the flu shot can save lives. Immunologists refer to the term herd immunity, which means that if a majority of the population is vaccinated against an illness, it will reduce the community's risk. Now that I have demonstrated the people who are at risk for the flu and how you can help, I will talk about the myths regarding the flu shot. The first myth is, you can catch the flu from the vaccine. This is false because according to Harvard Health, the flu shot is made from an inactivated virus and cannot transmit infection. People who get sick after receiving a flu vaccination were going to get sick anyways, and it takes about 1 to 2 weeks in order for the flu vaccine to help. The second myth is, you don't need to get a flu shot every year. This is false as well as dangerous because the flu virus changes each year to different strains. You need to make sure that you're getting vaccinated to become immune to the strains that can cause an outbreak. And lastly, the third myth is the flu shot causes autism. According to the CDC, there is absolutely no link between vaccines and autism. The ingredient thimerosal was studied specifically. It's a mercury-based preservative used to prevent contamination of multi-dose vials of vaccines. Research proved that thimerosal does not cause autism. Now that I've cleared up some of the myths regarding the influenza, I will talk about the 2017 to 2018 flu season. According to the CDC, the 2017 to 2018 flu season was a high severity season with high levels of outpatient clinic and emergency department visits for the flu. The 2017 to 2018 season was the very first season to be classified as high severity among all age groups. Approximately 960,000 people were hospitalized, and 79,000 deaths due to flu-related symptoms were reported. All of these numbers can be reduced dramatically if we take the responsibility of getting a flu shot. Today's speech, I talked about the people at risk if they don't receive the flu shot, myths regarding the flu shot, as well as the summary of the 2017 to 2018 flu season. It's very important for everyone to get their flu shot, especially people who can. For people who are eligible for getting a flu shot, there is no excuse. The flu vaccine is offered at a wide variety of places. If you can't make it to your doctor's because of a patient overload, stop by your neighborhood Walgreens or Fred Meyer's. And if they don't accept your health insurance, they offer the vaccine at a very affordable price. I encourage you all to get your flu shot since we are currently in the 2018 to 2019 flu season. Not only should you get your flu shot, you should encourage the people around you to get one as well. Thank you for listening.